is a pleasure and honor to have with us today Shu-Ti Chiou, who has been a key person in Taiwan and Taipei in particular in the SARS outbreak and in advocating for better pandemic response during this past year of the coronavirus outbreak. And as many know, Taiwan has been successful at preventing the kind of outbreaks that have happened in much of the Western world. And I think it will be important for us to hear from her about what happened there and what lessons we can learn and how she sees the global pandemic response. So we will take some time for her to make a presentation about her thoughts, and we will still have time for questions afterwards, both questions that maybe will come up during the presentations and other questions that you have about how the pandemic response could be done better. Thank you, Shu-Ti. Please take the floor.
Thank you, Yaneer, for the kind introduction. Dear colleagues, it's my pleasure and honor to be here to share with you some of our thoughts and observations and our previous experiences. And I know you have been fighting for achieving zero COVID to end the coronavirus. I think it's a wonderful initiative and it's great to join you. Okay, so I will talk about briefly about my global observations, the variation in country performance and its impact on health and sustainable development. But then the second part, I will spend more time regarding what have made Taiwan perform well in 2020. I put it 2020 because I'm not sure whether we will continue to perform well in 2021. Okay, and then I will give some concluding remarks. And first of all, I would like to disclose my conflict of interest because I think the control of outbreaks is highly political. So I share with you my previous experiences with different political parties in Taiwan. In 2003, when SARS attacked Taiwan, I served as the health commissioner of Taipei City. The ruling party of Taipei City at that time was KMT, but the national government was ruled by the other political party, DPP. And currently, the ruling party of our national government is DPP. Okay, so I was seen somewhat as someone opposite to the current ruling political party. Okay, and from 2009 to 2016, I served in the national government while KMT was in charge of the national government. But my role is regarding health promotion policies and programs. Okay, so what are the global observations that I've seen? And you can see that according to WHO's data, the region of Western Pacific actually had much lower number of cumulative cases. And in terms of daily new cases, it also has one among the lowest number. And the number in Western Pacific actually is only about less than 1/10 of that of Europe. And if we look at the map, we will be able to see that it's one planet with two worlds. You can see Western Pacific region has a very light color, which means we have very low case numbers. And in September last year, actually, there is uh, an analysis published in Lancet. I'm sure many of you have read that. It examined the approaches taken by 9 high-income countries and regions that have started to ease COVID-19 restrictions. 5 in Asia Pacific region and 4 in Europe. So they compared Singapore, Japan, South Korea, Hong Kong, and New Zealand, and UK, Spain, Germany, and Norway. They looked at surveillance indicators, community engagement, public health capacity, health system capacity, and border control. And all these countries and regions actually are high income and have UHC. So probably it has nothing to do with whether they have universal coverage for healthcare, but they varied widely on the intensity of interventions, especially on border control. For example, New Zealand, South Korea, Japan, Singapore, and Hong Kong, they applied universal inbound quarantine for 14 days. Same is Taiwan. We also applied that, okay? And Norway, they applied 10 days quarantine with exceptions. Germany and UK only selective quarantine, and Spain, no quarantine, free entrance. Okay, welcome you on board. And then community engagement, such as mask wearing and physical distancing measures. They found that in New Zealand, South Korea, Japan, Singapore, Hong Kong, and Norway, there was high degree of universal compliance. But in Germany, UK, and Spain, they have difficulty in that. Okay, and they also mentioned the goal of zero COVID strategy, and which means whether the country or region would like to achieve zero domestic case by implementation of containment instead of just flattening the curve by mitigation. So containment means to find, to test, to trace, to isolate, and to support all cases. So it's important to find out all the cases and the context and do isolation and quarantine to stop the spread and then achieve zero COVID. That's also very important. So you can see for those countries and regions in that research, UK, US was not there, but I also put it for comparison. UK, US, Spain, they have similarly high cumulative deaths per million. Germany in between, and Norway actually is close to the other Western Pacific countries in Western Pacific region. And here I also included China and Taiwan. We also had extremely low cumulative deaths. So in Taiwan, we only had 11 deaths. Okay, and even among countries with a similar culture, they might differ. So you can see the difference between Sweden and Norway. Okay, and I observed, actually last year, March, I observed that US, UK, and Sweden have announced to adopt mitigation very early when US only had probably 400 daily cases. They announced to adopt mitigation. UK too, on March 14, I saw that Johnson announced that he would like to, they gave up testing everyone. No, they would not test everyone. They wanted to keep schools open. On March 15, I wrote in my Facebook, I said they did not listen to the voice of the Italian physicians. They said, don't treat COVID-19 just as common cold. And they said, it's important to protect the community so that the hospitals can be protected. So I calculated for UK in my in my post. I calculated for UK if they say they wanted to have 70% infected, with case fatality rate as 1%, there would be 460,000 deaths, which would be actually 80% of their annual total deaths. So that will create almost a doubling of the annual mortality rate. And at that time, Trump closed the border to Europeans, except UK. And in Taiwan, our minister also said he would not close border against Europe and US. I was very worried about that. So I wrote this post and I said, very sorry, in my last sentence, I said that politics could be more poisonous than virus because it's a political decision to save people's life, to avoid those unnecessary deaths. Okay, and actually, if the outbreak spreads, you can see that it's not evenly distributed to everyone. Actually, there were factors associated with some critical conditions and fatality. Okay, so in addition to old age and the male as the gender, also those risk factors for non-communicable diseases such as obesity, smoking, and ethnicity. So there were social determinants: age, gender, ethnicity, and the people living in the more deprived communities tend to have higher, tend to be the people died from COVID-19, and it's also associated with other non-communicable diseases. The analysis in China showed a similar result. So actually, it's a syndemic of communicable disease, non-communicable disease, and social determinants of health. And that's why Richard Horton, the editor-in-chief of Lancet, has argued that COVID-19 is not a pandemic, it's a syndemic, and it attacked people with non-communicable disease and with deprived social condition. And we had to handle all these conditions together. And also, more analysis have shown that countries with higher cumulative mortality rate from COVID-19 also have higher overall mortality rate from all causes of death. This is like what I have mentioned. And they have found that the number is beyond the extra number from COVID-19. Because when hospitals were taken down by COVID-19 patients, they will not be able to handle the other conditions timely. So actually people would die from other conditions more than before as well, not only to die from COVID-19. And I try to list the situations why people with lower socioeconomic status tend to get the infection more often than the others, and also to die from the condition more often than the others. And even during the recovery in the future, when we recover, actually, there would be the people to be impacted more continuously. But I will not go into the detail. And actually, COVID-19 pandemic has slowed the progresses towards SDGs. And how about the economy? Actually, of course, there is impact on economy. And this analysis was done in September. They look at the situation in second quarter of 2020 as compared to 2019. At that time, actually, China experiencing 6.8% decline in first quarter, already recovered, and with an increase of 3.2% of economy than the previous year. But they were not included in this picture. And you can see Taiwan, we had the smallest degree of decline. We only experienced 0.6% decline. And you can see those countries with smaller declines are also countries with lower mortality rate from COVID-19. So you can see there is this correlation between lower mortality rate and lower impact, lower decline in economy. It's very clear, and Yaneer has shown me another analysis, more recent analysis. It's the same, okay? So what have made Taiwan perform seemed to perform quite well. We had a very small number of cases, and we experienced a very small impact. In fact, in Q3 and Q4, we experienced increase in our economy. Okay, but what have we done? We were located very close to the first epicenter, and we were expected to have the second highest number of imported cases from mainland China. Okay, and we have done many things, and we published many papers regarding what we have done, including me myself. I also published a paper regarding our experiences. But among so many things which we have done, actually, compared to the other countries with more serious conditions, I will say we do not do many things. We enjoy easy control. But what's the secret to the easy control? First, people here, if we ask our people, including the experts and our citizens, they will tell you that it's because we had the SARS experiences. We had painful experiences during SARS outbreak. At that time, we had 346 confirmed cases. 71% were infected in hospitals. So we see hospitals as actually the victims of the outbreak. And the case fatality rate was very high. And we had several hospitals and one community locked down. And why did they have serious spread so that we had to lock them down? Because we had missed diagnosis of patients. Patients without travel history were very difficult to be diagnosed early, because if you do not have travel history and you have fever and cough, it's just like common cold. It's difficult to imagine everyone without a travel history having those symptoms to be a SARS patient, right? And likewise, COVID-19 non-specific symptoms, or even actually many of COVID-19 cases did not have symptoms. And COVID-19 can spread well before the onset of symptoms. See, so COVID-19 is even more difficult to prevent. And at that time, we had such problem of missed diagnosis for cases in community spread. We had people travel from Hong Kong to Taiwan. We did not have border control at that time. So we had people from Hong Kong, and they were infected, and they infected their family members. And then this spread to the communities. And so when the first case without travel history went to the hospital, it was missed. And unfortunately, that case was super spreading. It caused a super spreading event. So this is very unfortunate. So we learned that to avoid lockdown, we have to prevent community-acquired infections. And this relies on early border control, because as long as we can keep them only imported cases, we can continue to rely on travel history. And that's very important to help detect early cases. So we need early border control. But of course, sometimes there will still be some cases. So we implemented multi-level protections. I will show you later, okay? So at that time, when I had the first imported case in Taipei City, we tried to do contact tracing among family members, and we would like to implement health monitoring for healthcare workers, but we were refused. So at that time, I said we need, actually in Taiwan, we have a Communicable Disease Control Act. But at that time, the minister said, no need, we don't need to use the law. We just count on communication. That will be very good. That's perfect to communicate. So I said, no, actually, in fact, communication is not enough. We need to list SARS into our notifiable disease list, so that we can do everything that the law required and authorized us to do. And eventually on March 28th, at that time, the president said, it's important. We should rather do more instead of doing too few. So we should be over instead of being inadequate. So from then on, when we have the law to support, we require all healthcare workers and public transport workers to put on their masks. Okay, and school and public places were required to disinfect their environments often. Okay, and for those people under quarantine, they will be fined if they violate the requirement. But to keep them in their household, we delivered meals and other supports for them. Okay, and but unfortunately, because of a missed case, which proved to be a super spreader, and the hospital was badly hit. So we locked down that hospital, and we invited the experts from US CDC to enter that hospital to instruct our colleagues to do a better nosocomial infection control. And we also invited our former health commissioner to enter that hospital to serve as a commander inside the hospital. And then we had one nurse who was infected before the lockdown. She died afterwards. So we had this mourning for her death. And every day we held a press conference to let people know everything and our progress and the situation. And also the premier visited the Taipei city. And afterwards, we set up fever stations outside of the main buildings of hospitals. And inside the hospitals, every hospital implemented a traffic control bundle to separate 3 zones: red zone, yellow zone, and the green zone, and try to keep most of the patients without SARS and the healthcare workers in the green zones to make sure they were safe. Okay, and we received many supports and cards from the communities. And unfortunately, there was another hospital attacked, and it was the health ministry to help handle that situation, but they delayed the shutdown. They felt that the shutdown would make healthcare professionals very scared. So they delayed the shutdown. Unfortunately, that delay led to spread to hospitals in southern Taiwan. And then the premier, he designated a former minister to serve as a central commander. And that's the origin of our current system, with a central commander to be in charge of everything and make everyone doing the same thing under the outbreak. Okay, and very soon after the lockdown, at that time, that hospital's situation was controlled, and afterwards another hospital. But eventually, actually, for that outbreak, we did not have new case related to that outbreak within 20 days. Okay, so the lessons from that outbreak: first is to use the Communicable Disease Control Act. It's very important to support strong interventions. And we had the pilot operation of Central Epidemic Control Center for interdepartment collaboration to support the Ministry of Health. And we set up all the standard operation procedures for contact tracing, quarantine, isolation, and staff health monitoring. And we practiced mass masking for our citizens. After requiring healthcare professionals and public press workers to wear the mask, afterwards, actually, our citizens also practice mass masking. And hospitals, as I mentioned, they set up fever station, they implement traffic control bundle. But the weaknesses are the lack of adequate information on the new disease and the delayed border control. Actually, at that time, we did not ban entrance of foreigners. And we also found that the hospitals did not have adequate infection control capacity. And we, at that time, we also have uncontrolled infodemics and the inadequate public health infrastructure to handle the situation. So afterwards, we invested in developing a more prepared system, including strengthening the staffing, training, research lab, and surveillance system of our centers for disease control. And we also strengthened the infection control program in hospitals. And we did audit, and we included this in our hospital accreditation program. And we also amend our Communicable Disease Control Act to ban the spread of wrong information. Okay. And so this time, in 2009, the last day of 2009, we were aware that China officially reported the cases to WHO. Actually, before that, we already heard some rumors from our people in China. And so when it was confirmed, we started onboard health check in the flights from Wuhan. And very soon we initiated everything, and including we launched the total ban of any entry from Wuhan on January 23rd. And then we expanded the border control to anyone from mainland China. And afterwards, we actually initiated all the ban for all the foreign passengers on March 19, when the epicenter moved to US and Europe. But this was not directly from the minister. It was after our strong advocacy to also launch the ban against Europe and US. So eventually the government listened and adopted our suggestion. Okay, and we implemented universal quarantine for 14 days for our citizens who returned. And recently we allowed more people to enter, for example, the foreign workers, but all of them have to undergo quarantine for 14 days. So we have the centralized command center to do the coordination, and they released the newest information every day. And when necessary, they held a press conference. Okay, but also we have something we call advanced deployment phenomenon. What does it mean? This is the deployment in advance of the central commander's order. Why is that? Because our central commander, the minister, said he would like to maintain some degree of flexibility. He would not like to be too radical or too invasive or too aggressive. However, the healthcare sector, some local governments and the managers of workplaces and the managers of public places, and many of our citizens and us, we as the experts and the opposition political party, we worried that his intervention was not enough. So we tried to implement higher intensity of interventions, or to advocate for higher intensity of interventions. And we tried to say that, okay, we are all following the commander's order, but it's only to do advanced deployment to support him. To give you some examples, for example, on January 25th last year, 2020, people already were wearing the masks when they were gathering outside a temple to wish for the best for the Lunar New Year. They put on the mask. You can see many of them. And the former president, he actually is the former mayor of Taipei City when SARS attacked Taiwan. During that Lunar New Year holidays, he also put on his mask. But our president, she also went to the temple. She did not wear the mask. And the journalists asked the president, saying, why didn't you put on the mask? The former president has done that. And our presidential hall even released a formal announcement saying that, oh, it's still not necessary. We don't want to cause any panic to the public. So you can see we were practicing advanced deployment. We already put on the mask before the government said we should. And this is my comment commentary on the newspaper on March 9, I said everyone actually should put on the mask. And it's April 5th that finally our president, our premier, and our central commander said that, okay, we should put on the masks. And as I mentioned, when Europe and US became the new epicenter, it's on March 6th and March 17th. On March 17th, our minister, he said he would try not to close the border and to do the infection control at the same time to protect the economy. So you can see actually politicians say similar words. So we were very alert to anything in China, but we were not so alert to things in Europe and US. But we need people to speak up. So we spoke up, and including many other experts. So eventually, the government announced on March 18th that, okay, at that time, we detected many imported cases from our citizens returning from UK and Spain and Italy. So eventually, they announced that, yes, okay, we would shut down the border against everyone, all the foreigners. Okay, and they have been doing, the local governments have been doing a lot of works. For example, for people who, our citizens who returned, before they arrived at their home or the quarantine hotel, this process, the transportation process, they would also like to do a best job. So they had these quarantine taxis, which were familiar in doing the disinfection and everything. Okay, and so they were trying to prevent all the leakage, any leakage, and there was a county government which tried to establish epidemiological data for their county, because in Taiwan we did not do population-based surveillance, but that county would like to do something. But then this upsetted our central commander, and he was the health chief health director was investigated, and we said a lot of words to support him. Okay, so and I will show you that in addition to border control, it's also important that we link our data to the clinical system so we can detect imported cases early. And also it's important to practice universal precautions for our people: masking, physical distancing, avoidance of public activities, and frequent hand washing. These are also important. So even some cases might be missed, but still, if you wear the mask and you wash your hands often, then you can also still protect yourself. That's the last line of protection for yourself. And people often say resilient health system is important, but as I have shown you, those countries with very good health system is still not enough. But okay, as people would like to say that, I will show you. Okay, we have universal health coverage with 99.6% of coverage, and we have well-functioning digital technology. We have the QR code for health claims for citizens returning to our country, and during quarantine, we have the cell phone-based electronic fencing to make sure people stay where they should be. Okay, and sometimes for contact tracing, actually, for most of the contact tracing is manual, but sometimes with mass gathering, we would apply geopositioning to help contact tracing, but it is rarely used. Okay, and then for patients under isolation, we practice the telemonitoring to reduce the times needed to enter the ward to have contact with the patients. Okay, and we also have telecare and the medicine, but I don't think they are very important. I think the most important thing is border control and universal precautions. Okay, and for people under quarantine, we subsidize them some money and food so that they don't have to worry about their absence from work. Okay, and for hospitals and clinics, they take a lot of care of patients. They also were subsidized with extra money. And we have been implementing healthy cities and health promoting settings like health promoting schools, health promoting workplaces, health promoting hospitals, and age-friendly cities and age-friendly hospitals for more than 2 decades. We felt that this is important for high degree of community engagement, high degree of health literacy, and high degree of the shared value among politicians, especially local politicians, that they should protect their people's lives. It's first priority. I think that's also important. So in conclusion, to do a good control of the to avoid the spread, we need not only health system but also good governance and partnerships between government, local governments, and central governments and private sectors. We need to have resilient cities and communities and innovative technologies. We can work together. And so based on the SARS experience and the strengthened preparedness, we took swift, vigilant, and decisive response against COVID-19 very early. But when the epicenter shifted to the Western world, then actually it's the advanced deployment, the voices to call the central government to attention, which is the critical factor to launch the second border control against the Western world. So I will say it's the robust democracy that played an important role. And then actually, yes, the communities and cities is important. And we share a strong wish to maintain zero COVID. We know that if there is any community case, our people will be scared. The economy will shrink to a very serious extent. So it's important to achieve zero COVID, zero domestic case. Okay, but still we have our own problems. Okay, our national government did not want to do as many testing as possible. And we currently, as we did not have big problems, so we did not have the strong motivation for further digital transformation of our healthcare system. And we had serious delay in our vaccine development and procurement. And actually, after August last year, there were several episodes of net and media attack against persons expressing different opinions and against local governments. And we felt this is not a good sign for a robust democracy. We should continue to keep a robust democracy for participation of views to help the government do a right decision. So it's important that good control is a key to protect health and protect economy and to protect sustainable development. If you protect people's health, you will protect economy. If you would like to protect economy first, and there are a lot of life loss, you will have economic loss too. Yeah, and good governance is critical to good control, but democracy itself is not enough. It's not a guarantee. We can see very clearly. So it's the robust democracy, and we worried about the recent extremism in Taiwan. Okay, and the situation can change very quickly. So if we start to do not only lockdown, after lockdown, if we do strong containment approach to check, to detect, try to detect every case and to isolate every case, to quarantine every contact, it's possible to achieve zero COVID. And the situation can change quickly. If we do something, we do more, then we will see the curve to drop soon. But if we relax the restriction, the curve might get up very soon if we did not arrive at zero. So when the curve is low, is it the best time to reopen? Or actually, as the curve is low, the case number is small, it might be also the best time to clean up to zero. So which way should we go? Yeah, that's my my final question. Thank you for your listening.
Thank you so much. That was really wonderful and very inspiring, Shu-Ti. That was great. We have some questions here from our audience. So I will start with Blake. You can come off mute and you can turn your video on and ask Shu-Ti your question.
Thank you. It's not letting me turn on video. The host didn't allow it, but audio is fine with me.
Okay.
So, oh, there we go. Well, Shu-Ti, thank you for your talk. And there was something you mentioned early on about the difference between the countries that went for a containment strategy versus a mitigation strategy. And you had a slide, which I'd be happy to see again if you like, that showed that there was a corresponding difference. The countries that did the containment were also the ones that had high cooperation with the people. And the ones that chose mitigation were the ones that did not have large cooperation. So the question is, it seems like a chicken and egg problem. Which one is causing which? Is it that perhaps the government is choosing to do mitigation only because they think that people will not cooperate? Or is it that the people don't cooperate because the government has made this plan already and they don't think that their cooperation will be helpful? And it seems like both could cause the other. How do you think we break out from this feedback loop politically?
Yeah, so actually, I think you are also aware of the editorial of New England Journal of Medicine, signed by all the editors, talking about the leadership vacuum, right? So it's leadership. How can we count on people to be smarter and wiser and more professional than the government? Of course, we respect people's opinions, but in the society, we need, and you can see in Taiwan in 2003 SARS outbreak, and then this time we had make this mechanism mandatory, saying that when there is a big outbreak, the government should kick off the operation of the central command center, right? So it's important that we have the leadership, and we through the press conference every day, and in our law by banning rumors. So actually, the government have the perfect power to spread the right words and to show the number every day. And our people made it a habit to see the number every afternoon, 2 o'clock. We wanted to see whether there is a case or there is no case. When there is no case, we say, whoa, great. So people will make it a habit that we would like to so much relieved that 0 today. So that can be shaped, but it counts on the proper leadership. The government has to take up the responsibility under such situation. But it's unfortunate that I saw it's the political leaders in Western countries who were the first to surrender, or even the person to spread the wrong words. It's awful. That is why I say politics can be more poisonous than the virus, right? So politics, if it's good, it will save a lot of lives. But if it's not properly functioning, it will be awful. So sometimes I worried that for the economy, who speaks for economy, right? Is it every one of us, or is it the big companies? certain companies, they would like to see the lockdown. They spoke to the politicians directly, while we ordinary citizens, we did not have the channel. Whom should we speak to? So I think it's important that we hold politicians accountable. There is no way they get away from the responsibility to safeguard our people's lives, right? Yeah.
Thank you very much.
Thank you. Thank you, Blake. Does anyone else have any questions or comments? We did have a question from Sanjeev Kumar. It looks like he has stepped off the line, so I'll read his question on his behalf. He asked, what should India do in the current scenario of ever-rising COVID positive cases? Is there some catalytic strategy that could be implemented at smaller geographical levels, such as districts and states? I will also put this question in the chat for you to read.
Okay, yeah, I would like to see that. Yeah, so you mean for people infected? From my computer, I only see the current trends. Yeah.
No, he's
Okay.
he's asking what should India do?
India.
India, yeah, because they
Okay.
have very rising cases now, very severe.
Okay.
Yeah. What should they do?
Okay.
Is there a strategy that can be implemented in small areas?
Okay. Yes, I think it's important to have geographic mapping of cases. We need to locate where the outbreaks are. Okay. So, and then according to the levels of situations, for communities with 0 case, good, continue. And for communities with some cases, they can do contact tracing, isolation of cases, contact tracing, and quarantine of contacts. But with communities with very high number of cases and almost impossible to trace each case, then lockdown for some period would be necessary. However, lockdown is not only lockdown, okay, stay at home. No, after lockdown, still people should receive testing, and it's better to find out cases as many as possible and to separate them from their family members. Okay, so in Taiwan, some scholars have tried to simulate different situations and to and to say to which level should we practice lockdown. And in China, they put communities into each of a small area. So they look at each small scale communities and to see whether there have been some cases and whether mass testing to that community is necessary. Okay, so then they did mass testing early and then clean up to 0. That's what they call it. Clean it up to 0 as early as possible to avoid mass lockdown.
Yeah.
Thank you. We have another question up next from Rupert. Go ahead, Rupert. You're able to unmute and come on video now.
Yeah, thanks. Thank you, Professor Chiou, for an inspiring presentation. I am speaking to you from the United Kingdom, which, as you know, is one of the countries that has done very badly in this crisis. And we look at countries like Taiwan and New Zealand, other island nations, and say, where did we go wrong? So my question is this. Those of us like myself who are trying to tell our fellow citizens and policymakers that we should have been more like Taiwan and New Zealand and so on, and that we should have followed the precautions that you took so intelligently. Has there been also a further impact in Taiwan of the success that you have had? In other words, do you think that politicians and policymakers and citizens in Taiwan have understood that the case for making precautions applies not only in relation to pandemics, but in relation to other fields? So, for example, I noticed that you are very interested in and involved in sustainable development. Is there any awareness in Taiwan of the way in which the kind of precautionary measures that you took so intelligently on coronavirus could be extended and scaled up to play a role in relation to the broader ecological crisis, the climate crisis, and so forth, from which actually the coronavirus partly emerged? I'm interested in this question because if the answer is yes, then I think this is very encouraging for humanity. So I would love to know whether people's minds in Taiwan are just fixed on the pandemic, or is there a more general lesson being learned about the positive results that can come from being precautionary in diverse human endeavors?
Yeah, yes, thank you for that question. And that's very, very important. And in the past 2 decades, I think our, and at the same time, I would also like to mention that NGOs are very important. We have NGOs, including some religious groups like Tzu Chi Buddhists group. They have been advocating for environmental protection and for climate issues. We think that's very helpful. So anyone to do such kind of advocacy in the community, in the society, that's very good. So everyone can do that, and everyone should, be courageous to do that. And the more, the better. So we have people advocating for environmental protections, which we think are quite helpful. And in the field of public health, for tobacco control, we have NGO advocating for that. And me, myself, when I was a full-time professor in Yangming University, I advocated to ban the use of trans fat, and we eventually succeeded. So I think these are helpful, and our people are learning. People can learn. Yes, in democracy, we say, oh, people are the bosses to politicians, but we need to be empowered. We people, we have to grow to grow our ability to serve as the boss of politicians. And I think the efforts from NGOs are very important, and we continue to learn. For example, recently we had a train accident in the east part of Taiwan, which caused 49 deaths, beyond expectation. And our people were so sad. We were very angry. And the first thing the Ministry of Health did was to raise for money. We felt it's, and I'm sorry, I'm again the person who played the bad face to speak up to the government, that I said the most important thing is not to, they try to let the emotions have somewhere to go. I said, no, the most important thing is to turn the sadness into the courage to find out the root cause of the whole system. Okay, and it's not only me. I'm here, so I said that, but a lot of persons, a lot in Taiwan, we said that, and they said that to the current president. Okay, so and then eventually the Minister of Transportation resigned, but we are hoping that our Bureau of the Railroad can improve a lot from deep inside. Okay, so. But I will not say we are perfect. I am worrying about our politics. it is going to extremism, to populism. So we have a harder time. We have a harder work to do, but we have to continue. We must, no matter how many, no matter how many, it is not too many. Please continue your great efforts. When I learned about End Coronavirus Initiative, oh, I was so excited to know that there are a group of people doing this thing. It's wonderful that you are doing this, and please continue your efforts. It's wonderful.
Thank you.
Thank you. We'll go to the next question here. Let's see, I think there was one of Scott. Go ahead.
I'm unmuted. So, Doctor, the presentation has been great. I'm sorry I arrived a few minutes late, and I hope that this question hasn't been answered or asked. And I have a couple of short questions. And thank you, Katie, too. I'm Scott Cooper. First of all, when you speak of people from the national level taking over, that's one of the, I think, the serious problems that we had is we had no national direction, if I may be so bold to say so, and feel that that would have been very important. Also, I don't know if this is too broad a statement, but I feel as if many people in the East are more comfortable or used to seeing masks from time to time, where we in the West are not. And I don't know if that would have been an impact at all. Do you feel there's a difference there that was of consequence?
Okay, thank you. So the first question is about the leadership at the national level, right? Yeah, I think, yes, of course, some countries, they are states, right? But still they have the president, right? And then what do we want the president for? And actually, it's very important, as I mentioned, communicable diseases spread from one place to another place, from one state to another state. So we need a government to coordinate matters between states, right? If it's states or provinces, anything like that. So still, I think that's important. And actually, some people would blame it on the design of the system. But as you can see, during SARS outbreak, at that time, we did not have the design of the central commander, but we found it was important. And then we started to do that. So whether we want to do things according to what is needed or according to what is there, I think it's up to the leader's decision whether he or she would like to support the people or to just say, oh, I have already excuse, which is, please blame on the system design. It's none of my business. That's awful, right? We have the system, but we also have a living leader, okay? And then regarding the masks, yes, we found it because I have friends in other countries, and my son actually lived in California in 2020. So we know that you talk about mask, right? Yes, and that was an issue, I believe so. But again, that's why we count on leadership. It's difficult to change immediately. However, for that country where the New York Journal of Medicine has published the editorial, that country, after the previous president said no need to wear the mask. If the leader is spreading the wrong message, right? How will people learn? But immediately the new leader said, let's put on the mask, and people, yes, sometimes people will not put on immediately, but if we do our best, more would put on, right? And more will see the benefit. So it's important what's in the mind of the leader to spread the right words, the right messages, or to just, I don't know why they I hope it's not impolite to say these words, but I have been wondering why they did it that way. But again, no matter which country it is, I think we as citizens, we have to hold politicians accountable. And there are difficulties, of course, yes. And in Taiwan, we have our difficulties too. But for those difficulties, we need the solidarity to solve it together. And leader is the person to strengthen the solidarity instead of splitting the country into two parts. Yeah.
You can't speak enough of what went on in the States and the lack of leadership. So feel free to say whatever you want. I just wanted to follow up with probably should have been my first question because you were all on the topic, and that's about NGOs. Here we are in the States. I know Katie knows me. We have lots of different organizations that are working on masks, on protection, on getting the vaccine out, making sure everyone's taking it, but they're all NGOs. They're as effective as they can be. But somehow the NGOs here, though there is cooperation amongst us, there's never been a leadership in a sense, which is harder to do since we're all independent organizations, but a leadership to bring us all under one, for lack of a better term, umbrella. Because this would make us so, you know, it's the power of many. It takes a village, you know, it would be so much more effective. And the NGOs that you have, are they also in a way separate or are they joined in some way?
It depends. It depends. When I was doing tobacco control, when I was trying the most radical approach, which is to raise the tobacco tax, which is the most powerful one. Of course, I encountered a very strong backlash from industry, and we try to organize NGOs to work together. So, for example, for press conferences, we invited representatives from NGOs to sit in and say their words. And at the same time, I feel that although for infection control and for many things in the field of public health, healthcare sector is not the one to solve the problem. It's the public health, or even it's the top leadership to solve the problems. However, healthcare sector usually is seen as a credible voice. So quite often, I also work with them to ask them to speak for the patients, for the lost ones, and to say we should stop this tragedy. Yeah, so I think, and in Taiwan, we say there are 5 fingers. It's we should work with NGOs, civil society, we should work with the professional groups or experts, we work with industry or private sector, we work with government, the other departments, and we also work with media. We say media is one among the partners we count on to work together. One hand has 5 fingers. We need to work together.
And it's good when it's a fist. Thank you both very much.
Thank you. Thank you.
Thank you so much, Scott, for that last question. We're going to move to Yaneer to wrap up with some final words. Thank you so much, Professor Chiou. This was really inspiring. It's so great to see a country that's able to do it. We need that more than ever here in the West, and we really appreciate you and your time today. All right, Yaneer, I'm going to pass it over to you.
Thank you. We knew before we came to the presentation that Taiwan had done an outstanding job compared to the rest, much of the rest of the world. But what I think we learned the most is that Taiwan faced internally many of the same challenges that were found in other countries, with the relationship between public health and government not always being aligned, with the challenge of clear information and making sure that people understood what the danger and the harm was in a context of public discourse. And it's very indeed inspiring to hear from Shu-Ti the way she contributed, and her efforts have been effective in shifting the conversation, in affecting the policies, and in really making tremendous contribution to the outcome of their response effort. So let us all be inspired by her example, and find ways to be successful in this terrible time, but a time that has been shown that it is our control, our actions that matter. Thank you very much, Shu-Ti. We look forward to working with you on this effort. Thank you.
Thank you. Thank you. It's my pleasure and honor. I'd love to work with you all. Thank you so much for helping this world. You are great. You are great. Thank you.
Thank you so much. There are opportunities to continue staying in touch with us. We just put some information in the chat. We have an international call at 2 p.m. Eastern time every Wednesday. We have the link in that chat. If you have any questions at all about joining our efforts, you can please email me at katie@nexi.edu, which is also in the chat. I appreciate everyone's time today. We can do this together if we make our voices heard. Please follow us on social media, share this video, like and comment on our social media accounts. That would be super helpful. Thank you so much, everyone, for joining today, and have a great rest of your day. Thank you so much.
Sure.
Take care.
Bye-bye. Take care.
Bye-bye.
Bye-bye.